We've all been raised to expect that a heart problem is going to be loud. We picture that sudden, dramatic chest pain we always see in the movies. But here is the truth. As we get older, our bodies rarely work that way. For most of us in our 50s, 60s, and beyond, a struggling heart doesn't shout, it whispers. It sends out quiet, subtle signals. And those signals are incredibly easy to brush off as just another normal part of getting older. You might think you're just out of shape. Or maybe you just had a rough night of sleep. I know how easy it is to tell yourself that you just aren't as young as you used to be. But ignoring these quiet warnings can be a costly mistake. Recognizing what your heart is actually trying to tell you is one of the smartest things you can do to protect your independence right now. There are 7 specific, often overlooked signs that your heart might be struggling. And paying close attention to them could give you the exact window of time you need to talk with your doctor. You want to do that before a minor issue turns into something that changes your whole life. So, let's get into the first subtle signal. You need to watch out for a deep, unexplainable sense of exhaustion. Now, you might be wondering what makes this different from normal tiredness. This isn't the regular fatigue you feel after spending an afternoon working out in the yard. And it isn't just the grogginess from a bad night's rest. We are talking about an overwhelming, heavy fatigue. It's the kind that seems to settle right into your bones after doing things that used to be completely effortless. Think about your normal daily routine for a second. You might find that simply walking out to the mailbox or carrying a couple of light grocery bags forces you to sit down. You just have to stop and catch your breath. That really matters. Let me explain why. When your heart muscle weakens, it has a harder time pumping enough oxygen-rich blood to keep up with your body's daily needs. To handle that, your body starts making compromises. It actually takes blood away from less critical areas, like the muscles in your arms and legs. Instead, it sends that blood straight to your brain and your core organs. That's exactly why your arms and legs can suddenly feel like they weigh 100 pounds. If you notice a sudden, steep drop in your daily energy levels, your heart might be quietly asking for a checkup. And here is the thing. That heavy exhaustion often carries right over into how you sleep. That brings us to our second warning sign. A lot of people notice this one before they really know what it means. If you find yourself struggling to catch your breath when you lie down flat in bed, pay attention. Maybe you suddenly need to prop yourself up with 3 or 4 pillows just to get comfortable. You are not alone in this. And it's a very specific red flag. In medicine, doctors call this orthopnea. As we age, if the heart's pumping ability starts to slow down, it can't efficiently clear the blood that's returning from your lungs. When you lie flat, gravity naturally shifts fluid from your lower body back up toward your chest. A struggling heart just can't handle that extra fluid volume. So, the pressure builds up, and fluid actually begins to push back into the lungs. It creates this really uncomfortable and sometimes frightening feeling of breathlessness in the dark. I know this can be frustrating and scary. If your breathing changes the minute your head hits the mattress, it's time to have a friendly conversation with your doctor. That issue with fluid leads directly into a third sign, and this one is highly visible. Take a moment to look at your feet, your ankles, and your lower legs. Gradual swelling in those areas, especially right at the end of the day, is a classic signal. It should never be ignored. It is so easy to blame swollen ankles on sitting in your favorite chair for too long. Or maybe you think it was just a salty meal at a restaurant. And sure, those things can play a part. But chronic swelling happens because a heart under strain simply doesn't have the driving force to push blood smoothly through your whole body. Since your lower legs are the furthest point from your heart, blood can start to pool down in those veins. The pressure builds up, pushing fluid out into the surrounding tissues. That is exactly what gives you that tight, puffy feeling. You might notice your regular shoes feel painfully tight by 3 in the afternoon. Or maybe your socks are leaving deep red marks in your skin. For older adults, that kind of persistent swelling is a strong hint that the heart is working much too hard to keep up. While fluid retention is mostly a plumbing issue, Your heart also communicates through unexpected physical pain. And that is our fourth sign. We are talking about discomfort in areas you would probably never associate with your heart. It could be your jaw, your neck, your upper back, or even an ache in your shoulders. Doctors call this referred pain. Let me explain how this works. The nerves that connect to your heart share the exact same pathways as the nerves running to your upper body. So, when the heart muscle isn't getting enough oxygen, it sends out a distress signal. But your brain can actually get confused about where that signal is coming from. It might read that heart distress as a sudden, dull ache in your jaw, or maybe a strange, deep stiffness between your shoulder blades. And honestly, this is especially true for women over 50 and 60. Women's heart symptoms often look totally different from the textbook examples. If you get a strange, radiating ache in your upper body, do not just brush it off, particularly if it flares up when you're moving around and fades away when you sit down to rest. Don't just assume you slept on your neck wrong or pulled a muscle. Another easily misunderstood symptom centers around your balance. This fifth sign is something people brush off constantly. Experiencing frequent dizziness, feeling lightheaded, or are having sudden moments where the room just seems to spin. These are things you need to take seriously. As the years go by, our bodies naturally get more sensitive to shifts in blood pressure. But if your heart isn't beating in a steady rhythm, or if a valve is getting weak, it might momentarily fail. It might not pump enough blood straight up to your brain. That brief drop in blood flow is exactly what causes that sudden, unnerving wave of dizziness. For older adults, this is a really big deal. It significantly raises the risk of a fall, which brings an entirely different set of serious problems. Think about the last time that happened to you. If you feel dizzy and it doesn't clear up in a second or two, you need to be careful. Or, if you feel a little faint while you're just walking through the house, your heart might be struggling to keep your blood pressure where it needs to be. Beyond your sense of balance, your heart and your lungs work as a closely tied team. That brings us to the sixth sign, a nagging cough or a strange wheeze that just won't clear up. This is almost always blamed on lingering seasonal allergies or the tail end of a stubborn cold. It is so incredibly easy to dismiss. But when the left side of your heart can't keep up with its workload, blood can actually back up into your lung veins. From there, fluid slowly starts to collect inside the tiny air sacs of your lungs. Your body responds the only way it knows how. It tries to cough it out. This creates a chronic, irritating cough. Often, it gets noticeably worse when you lie down to rest. It might even bring up a bit of white or slightly pink mucus. It's incredibly common for seniors to just live with a cough for weeks. I know it's easy to just ignore it. But if you've tried all the over-the-counter syrups and nothing touches it, the root of the problem might not be your lungs at all. Your heart might be asking for some help. Now, the final warning sign might be the most surprising one on this whole list, and that is because it happens right in your stomach. Experiencing a sudden wave of unexplained nausea, totally losing your appetite, or feeling incredibly full and heavy even if you've barely eaten anything. These can all be directly tied to heart trouble. Here is what's happening. When the right side of the heart isn't pumping the way it should, blood backs up in the veins coming up from your lower body. That extra fluid can literally congest your liver and your digestive tract. The result? You feel bloated, a little sick to your stomach, or just completely unable to finish a normal, healthy meal. Because indigestion stomach aches are just a normal part of life, they almost never get linked to heart health right away. Yet, if these digestive changes are totally new for you, you should pay attention. If they hang around for a few days, and especially if they show up alongside any of the other things we've talked about, they absolutely warrant a closer look. Navigating your health as you get older is really about learning to listen. Your body has tirelessly supported you through every single decade of your life. And now, it relies on you to recognize when things shift. None of the signs we've walked through today are reasons to panic. In fact, many of them can be tied to other, very manageable everyday conditions. They are simply signals. They are your body's gentle way of tapping you on the shoulder. It's just a reminder to check in with a doctor. If you recognize any of these changes happening in your own daily routine, please don't just write them off. Don't just assume it's a normal part of aging. You know your body better than anyone else. Make an appointment. Tell your doctor exactly what you've been feeling, and advocate for yourself. Protecting your heart and your future starts with paying attention. It starts with making smart choices, and it means never ignoring the quiet warnings. Take good care of yourself, and I'll see you in the next one. Thanks for watching.